but also on our prenatal to 3 work, school safety work, working with our Homeland Security divisions, Health and Human Services to tackle those kind of issues, as well as workforce readiness. In terms of just a little bit of background of how we got into a focus on chronic absenteeism with the Every Student Succeeds Act, we found that there was a real uptick in discussions in states, not only as part of state accountability systems, the inclusion of chronic absenteeism, but just an uptick in conversation overall on what this means and how to best address chronic absenteeism. With so much movement on the state level, we thought it was worth diving deeper into the issue and how states can address it. We'll talk about today some of the metrics that states are using to define chronic absenteeism, what's the impact of chronic absenteeism on students, what's the strategies and models that states are using to address chronic absenteeism from the perspective of education, health, and human services, and of course, how can governors provide the space, environment, conditions, and leadership for this work to move forward in states. So we'll kick off with 2 of the foremost experts in this area, Dr. Bob Balfanz of the Everyone Graduates Center at Johns Hopkins University, and Hedy Chang of Attendance Works to begin to ground us in this work and really frame the conversation. Then we'll turn to a few state examples from Oregon and Texas. So Dr. Balfanz, turn it over to you.
Great, thanks, Seth, and good afternoon, everybody. So Hedy and I are going to take a few minutes here just to give us a little bit of background. I'm going to talk about what chronic absenteeism is and why it matters, and then Hedy's going to really focus on what we can do about it. So if we go to the first slide, and can someone else do those perhaps? I do not see the control for myself to do it. Okay, one more. Yep, there we are. So, right there. Excellent, right there. So, chronic absenteeism is really, in essence, the idea of missing enough school that it matters, but it's being more and more commonly defined as missing 10% of school for any reason. And for any reason, we mean excused absences, unexcused absences, and suspensions. It's really you miss a school for any reason, that counts up towards are you chronically absent or not. And the reason is, what we found is what matters is you miss school as far as your academic and other outcomes, not as much the reason behind it. And that's a big change in thinking about attendance. Because if we go to the next slide, in the past, we really measured attendance either by average daily attendance, which is what percent of kids are in the building on a given day. And that really had its roots, historical roots in how we funded education. And some states still do it that way. But what as it turns out, though, is that you can have average daily attendance in the low 90s. And we're hardwired to think that anything in the 90s is good, right? We've all been to school. We know something in the 90s is an A, right? But you can have, the math is such that you could have average daily attendance in the low 90s and still have between a fifth and a quarter of your kids missing a month or more of school. Because it's different kids on different days adding up to that average daily attendance. So that's why chronic absenteeism is a different way to measure it. And if we could just go back one slide, sorry, if we're getting ourselves organized. Yes. And then the other big change for thinking about chronic absenteeism, about how we've thought about attendance in the past, is the other way we've thought about attendance in the past was the idea of truancy. And I think this is very important, especially from the sort of governor's perspective. Because historically, truancy has been built into state law about if you miss a certain number of days of school for a certain number of reasons, like unexcused absences, X in a row or X total, then sort of it becomes almost a matter for the court, and it becomes almost a justice system issue. And we've learned over time that there's only a very rare occurrences when parents are actively keeping their kids home for various reasons that aren't always good, that the court getting involved can make a difference. But we've also learned that going to sort of easy punitive measures, like if you don't come, we fine you, or we fine the kid, don't work, usually make it worse, and often end up occurring large fines for both kids and parents, because often they became seen as a revenue source for local communities. So there's this big shift from seeing attendance as something that we have to penalize to a problem we have to solve. And that's part of the mind shift from truancy to a focus on chronic absenteeism. So if we go to the next slide now, what we want to show here is we're going to show 3 slides to give us a sense of some characteristics of chronic absenteeism, what we know about its nature. And what we're trying to show in this slide is 2 things. One, again, is that if we just count unexcused absences, particularly in the elementary grades, we see that undercount how much school is being missed. So the line underneath shows you if we just counted unexcused absences. The red line on top of it shows if we count all absences. You can see a lot of absences are missed if we don't also count excused absences. The other thing you'll see is there's sort of a U shape to the data, which is we know that chronic absenteeism is quite high in pre-K, kindergarten, and first. It gets lower in the elementary grades, 3rd and 4th grade, often in the years that have the lowest level. And then it starts ticking up in the middle grades, the transition to 6th grade. It also accelerates again between 8th and 9th grade, the transition to high school, and gets quite high again. So it's both a high challenge in the early grades and a high challenge in the middle and secondary grades. Next slide, please. Another key factor about chronic absenteeism that we have to understand is that it sneaks up on you. This just shows you a pattern of chronic absenteeism, which is just missing 2 days a month, 3 days in 1 month, and 1 day in another month. That all adds up to almost 20 days or more than 20%. But one reason is that it turns out that both parents and kids often underestimate their chronic absenteeism by half. So this is a key reason we have to keep putting good data in front of people so they really know what the data is, because we tend to think about our most recent absenteeism. And we think, oh, this month I just missed a day. That's pretty good. And we don't think about the cumulative effects. Next slide, please. A third key factor of chronic absenteeism is we don't do anything about it, it becomes chronic. It's not the case that kids, by and large, are chronically absent 1 year, then not chronically absent again. There's usually a reason for being chronically absent, and if we don't address that reason, it often doesn't go away. And so that's another key feature. And our data systems aren't set up to actually track over time how much of schooling of kids miss. And that's where you could get some of your most jaw-dropping data. If you track cohorts of kids over time through elementary school or through middle school or through high school and see how many cumulative days they've missed, you will get some very high and surprising numbers, because left unaddressed, chronic absenteeism becomes chronic, and the more chronically absent, more years kids have missed, the lower their academic outcomes, which is also demonstrated on this slide, in this case about early reading. Next slide. So those are some characteristics of chronic absenteeism. Now the question is, like, why do we care about it? Okay, so it's a new idea, it's a different way to think about things, it's got some interesting patterns to it we have to be aware of, it's easy to miss. But why we care is it's connected to all the academic and school success outcomes we care about. Strong evidence that if you miss lots of pre-K and kindergarten, you're not going to read as well, and that's going to carry through. It turns out that missing a lot of 6th grade is a key predictor that ultimately you're going to drop out. And these are things that governors invest in, right? They invest in pre-K and kindergarten access. And the point is if we make these big investments and don't do the work to make sure kids attend to benefit from those investments are a lot less powerful. We can see in the next slide, again, how tightly chronic absenteeism is linked to dropout. So we can have all these school improvement efforts, but if we don't make sure kids are there to benefit from them, they don't benefit from them, they still struggle in school, and they still ultimately drop out. And then if we go to the next slide, we see that this also plays out for post-secondary access and success. That even kids that are they're chronically absent in high school, but they manage to graduate, there's clear evidence that chronic absenteeism in high school comes back to make it harder for them to have post-secondary attainment. So again, we make big investments in expanding post-secondary options. And if the kids haven't had the ability, we haven't made it possible for them to attend school regularly, those investments have a lot less impact. We go to the next slide. the other key thing is that the kids that get hurt the most by not being in the school are the kids who need school the most. And this is all our efforts to have equity and to close gaps are also undermined when our highest needs kids who have the highest rates of chronic absenteeism are not in school regularly to benefit from all the good school reform work going on. Slide. Next slide, please. And the last one I'm going to show you before I turn it over to Hedy is just our first national look at how much chronic absenteeism is there. And again, just to think about where we are, is it wasn't until 2016 when the U.S. Department of Education's Office of Civil Rights data released data from the states from 2014 that we got our first national accounting of chronic absenteeism ever. Again, this sort of odd occurrence of the data has been there. Every parent gets in their report card most times how many days of school a kid has missed each quarter. That essentially is chronic absenteeism when you add it up. But we have not aggregated that data at the school level. So it's very rare for a principal to be able to tell you how many percent of their kids are chronically absent, how many are regularly attending, well, they could tell you average daily attendance in a second. So it's only been very recently we've had national data to tell us how many kids are chronically absent. This is following a slightly different definition. It's a 15-day definition as opposed to 10, but it's pretty close. And what this national data tells us is that there's some chronic absenteeism almost everywhere, but about half of it is highly concentrated. And only, in this case, 4% of districts you can find half of the chronically absent kids. And the other half of chronically absent kids are across many, many districts. So everybody has some, and then a subset of districts has a whole lot. Those places that have a whole lot are actually two quite different places. Some are very large suburban districts, sorry, that have 150,000 kids. And if they have 15% chronic absenteeism, that's, over 20,000 kids chronically absent. The other place that has very high rates are places of very high concentrated poverty, where they could have rates of 20, 30, 50% of kids chronically absent. Rural districts don't have as many kids, but they have some of the higher rates of chronic absenteeism. And with that, I'm going to turn it over now to Hedy, who's going to really talk to us about some of the things we've learned about what can be done to help reduce chronic absenteeism.
Thank you so much, Bob, for giving us that great foundation of what this is and why it matters. Turn over to the next slide. So, the chronic absence, while, as Bob said, the data has existed for a long time, it's only been in the last year or two that people have really started to recognize that that this metric matters. And in particular, the recognition was sort of accelerated by the Every Student Succeeds Act and the allowance to think about another additional metric, particularly around the additional metric on student success. And what happened is you had a whole bunch of factors about what you needed to have. You had a measure that was reliable, that was counted the same way relatively, that could be counted for every subgroup, and that had a clear connection to achievement. And it turned out that one of the few additional metrics that could easily be added and was based on data that was already collected every day by districts was chronic absence. So we saw this huge groundswell by the time September rolled around, and you saw state ESSA plans with the vast majority of states, 36 states plus Washington, D.C., adopting chronic absence as an accountability metric. Just to put that in perspective, 6 months earlier, there were 2 states, Connecticut and California. So in the last, in that very short period of time, we went from a couple of states to the vast majority adopting chronic absence as a metric. Next slide, please. And the adoption of chronic absence in ESSA is creating sort of unprecedented opportunities and challenges for addressing this issue. And we know that right now, a lot of states in this past spring have been really focused on business rules, because there are ways in which, while attendance is sort of defined similarly, it's actually not exactly defined similarly, and the devil is in the details to make sure that you can look at data, especially if you're using it for accountability purposes from one district to another, and you're in fact measuring apples and apples. Now people are also moving pretty clearly into how am I going to, once I know what the metrics are, what the measure of chronic absence is, how are we going to establish targets? How are we going to incorporate that? What's the weight that that's going to take? And then in the fall, they're also going to be releasing report cards. So some have already started releasing information where schools will be able to go and look and say, oh, is my chronic absence rate a challenge or not? And by winter, the bottom 5% of those low-performing schools with high levels of chronic absence are going to have to figure out how to connect the needs assessment and how to incorporate that chronic absence plan for addressing it into their school improvement plans. Next slide. One thing I wanted you to be aware of is that this immediate challenge of being able to make sure what gets counted is attendance. So for example, in one state, some districts count attendance, a day of attendance, as just being there one period, while other districts in that same state count kids being present for half the day as being there. And when you're looking at those data from those two districts in the same state, you might not actually be seeing the same thing. And this is why people are starting to really notice, hey, are we accounted for by accounting the same way? And this report by Future Ed really offers some great examples of what are the things that have to be defined so that you can count apples to apples. Next slide. As your states are figuring out what they count and how they count, given that there has been a longstanding look at equity issues and how that happens and gets played out in policy, I wanted to give you an example of if you don't know where your state is around defining these mechanisms, you might want to find out where it is and think about what's the impact of state decisions on particular issues, both the accountability, equity, the kind of support you're going to need to provide, and incentive to take action. Let me give an example. If a state, right now, EdFact says the kids who should be counted in a chronic absence report should be kids who've attended school for at least 10 days. That's actually a good metric. It means you're going to count most kids. There are some states, though, who said the only kids that will count are the kids who've been present 45 days or an entire semester. There's also different ways in which states may or may not have paid attention to how easily kids are enrolled. And the challenge is if you make a definition too stringent, a kid has to be there, let's say 60 days, you are going to lose out seeing what happens with kids, for example, who are highly mobile, who are homeless, who are often your most vulnerable. And that'll have an impact on your equity. But your decisions will make a lot of difference on whether or not schools think that they're accountable for those highly mobile kids, whether they have an incentive to take action to help support what's happening with those highly mobile kids. And you're going to have to think about, if we define this, who gets included in a certain way, what kind of training and guidance you want to offer to districts so that people include the same kind of data when they're reporting to the state. Next slide, please. Ultimately, when you have good data, the key is that it can help you to be able to understand what's contributing to chronic absence so you can come up with good solutions. To what extent is it related to barriers? What is it? Is it about negative school experiences? Is it about a lack of engagement? Is it about these misconceptions where kids might be missing a couple days, but no one realizes it's adding up? That's what Bob was talking about earlier. When you have data on chronic absence and you find, for example, that it's highly concentrated in a particular neighborhood, that might give you, you can use that plus other data to see, oh, we've got an issue of trauma. We got an issue of school safety, or there's an issue of transportation for that neighborhood. Or if you see chronic absence highly concentrated in a particular school and you look at what's happening with suspensions, it might give you an understanding that what we're having is a really poor school climate issue. And so what we have to do is actually address challenges of school discipline and climate and bullying that are in fact moving a lot of kids out, pushing them out of our school. So once you have the data and know where it's concentrated, you can use that combined with other data to figure out what's going on so we can come up with appropriate solutions. Next slide. Ultimately, this is really about creating a tiered approach to intervention that begins with positive engagement, building relationships, and then adding in more supports as children need them. And when you have your data, you can actually figure out, because this stuff is pretty standard, what your prior year chronic absence levels are tend to predict what next year's chronic absence levels are. And if you have that information, you can use that to start identifying how many kids just need tier 1, how many kids need tier 1 and tier 2, how many kids need tier 1, tier 2, and tier 3. And if we have a lot of kids with very severe chronic absence, it could really suggest we need community partnerships to help make sure that those kids have a chance to turn around their attendance and thrive in school. Next slide. Ultimately, this is about putting in place these kinds of key ingredients of change. You need actionable data with shared accountability, and then you need to build the capacity of schools and community partners to be able to engage kids, families in a positive way before they miss so much school that they're academically behind. And you can use the data to figure out who needs the support of school and community partners as early as possible before those kids fall behind. Next slide. One of the states that has been really fabulous on doing this work has actually been Connecticut. Sorry about some of the problems with, I think, when we transferred the slides. And they have actually put in these different key ingredients of change that really talk about that are within the schoolhouse, outside the schoolhouse. They involve positive community outreach. They also involve shared accountability, and they made it an integral part of their partnerships. It's a whole cross-sector approach that the Connecticut Department of Education and its key partners, the state, have adopted. Next slide, please. There's really a role for everyone, including the executive branch, the legislative branch, the judicial branch, the State Board of Ed, the Department of Ed, and other kinds of partners. And you can actually go onto our website and see more in depth, as well as the Connecticut State Department of Education website, on what they've done to put these kind of strategic collaborations, policies, and practices in place. Next slide, please. Connecticut is a proof point, though, because what they've done by putting in this very comprehensive approach to reducing chronic absence is they've been able to decrease chronic absence from 11.5% to they were predicting down to about 8% by the end of the 17-18 school year. There's a little bump that went from 9.6 to 9.9%, and that was largely because at that time they had decided that half-day kids who were in school suspension for more than half a day would be counted as absent for that day. And they then went back to not counting in-school suspensions as absent, and that explains that little bit of dip. But it's pretty much been a very constant reduction in chronic absence, because as a state, partnering with districts, partnering with all their agencies, they've put in place these key ingredients of change. Next slide. The other thing that we are starting to see states do, and I know that you'll be hearing from Robin, and I know that Oregon has really thought about this, but is thinking about how do you also create a tiered support system for districts, where all districts get some support. Districts who are still having relatively higher levels of chronic absence get more targeted intervention, and then districts who have the greatest challenges get more intensive intervention. Next slide, please. I'm not going to do this in depth because I know we need to move to our other speakers, but these are some examples of tier 1 supports, whether it's online, public reports, easy to tailor attendance messaging. We actually have these attendance modules that are on our website that anyone can get access to and use. These are really great supports that any district can use. Next slide, please. And then there's also, these are the kinds of targeted interventions that you can put in place, where you're actually allocating state resources to, let's say, for example, around health, to target places that have higher levels but also known health issues. You can also provide more in-depth training and coaching through your existing professional development networks. You can create peer learning networks. Last slide, please. And then as you think about this, you're going to want to answer some questions about what kinds of interventions that you're going to need to put in place and what do you want to offer. And actually, I lied. There's one last slide here. I just wanted to give you all a heads up that this fall, we're working with Everyone Graduate Center at Johns Hopkins and the Hamilton Project at the Brookings Institute to actually take the 15-16 data and do a really deep analysis of it. We are going to actually provide everyone with state-level charts showing what their chronic absence, school-level chronic absence looks like and how that has changed over time. And Hamilton is also creating a searchable map of school-level chronic absence where anyone can look at what any given school and see what their levels of chronic absence are for the country. And we'll be offering some insights into how you can use this data to really think about what's needed for school improvement in each one of your states. Thank you so much.
Thanks, Bob and Hedy. It was really helpful to have you kickstart the discussion in that way. And just for everyone on the line, we will be sending around some follow-up resources to this, including that Future Ed report that Hedy mentioned, to make sure that you have the resources you need to continue the conversation. We're now going to turn to some state examples, and Alex Cawthorn's here, our Program Director for Human Services, and she's going to introduce Robin Shobe to talk a little bit about Oregon's work in this area. So, Alex?
Thanks, Seth. So again, I'm Alex Cawthorn, the Program Director for Human Services, which is housed within the Economic Opportunity Division here at NGA. For a bit more context, we've just heard from Hedy about some of the barriers to school attendance that could really be addressed through some human services interventions. Human services programs offer opportunities for low-income families to achieve self-sufficiency and provide for their own well-being. Governors play a critical role in the protection and support of vulnerable children, families, and individuals. Governors continue to explore and implement new and innovative practices to serve the families, children, and individuals in their states. Some of the work we have going on within the human services portfolio area really reflects the population and the needs of families that are typically faced with chronic absence and the issues that are connected to it. So, for example, we have some work going on around two-generation strategies, improving family and well-being by serving children and their caregivers together, increasing economic opportunities for individuals and families, supporting systems improvements for youth involved in the juvenile justice system, and safely reducing the number of children and adolescents in foster care while supporting foster youth transitioning to adulthood. So as you can tell, chronic absence is not just an education issue. It's also a family well-being issue. We know that every chronically absent child has adult caregivers, and at NGA we view economic mobility through a whole family lens. Given the connection between chronic absence and other non-school factors such as housing instability, sibling child care, access to adequate transportation, income supports, and neighborhood safety concerns, improving student attendance requires the coordination across entire communities, not just schools. A whole community, whole family approach to impacting chronic absence includes parents, caregivers, neighborhood residents, civic organizations, businesses, cities, and county agencies, as well as faith leaders. As I mentioned a little bit ago, NGA's Economic Opportunity Division has invested quite a bit of time and resources into a tailored technical assistance activity for governors and policy advisors on the development of whole family approaches to serving low-income families, which is often referred to as a two-generation approach. The basic idea here is that rather than providing services to just the low-income adult or to just the child, we recognize that many of the people in our safety net systems are part of families, and so they ought to have coordinated service delivery systems that recognize the entire household. Two-generation strategies have been in existence for decades, but much of the recent work on two-gen strategies has focused on the development of the on-the-ground programs that directly serve families on a regular basis. Such two-generation programs typically provide services to both adults and their children, either by a single organization or through a partnership between two or more organizations. For example, a program may combine exemplary early childhood programming with robust parent education and employment services. So for a bit more about the two-gen work currently underway at NGA, We're currently administering a 2-year intensive TA activity, a policy academy, with a set of 5 states that were competitively selected based on their innovative proposals for 2-gen strategies for systems change and gubernatorial support. Those 5 states include Colorado, Georgia, Minnesota, New Jersey, and Oregon. At the directive of their governor, each state has developed robust cross-agency state teams that work toward policy change by reshaping child and adult-focused delivery systems to better meet the needs of low-income families. To get a little bit more into the PACT project in Oregon in particular, since we're about to hear from Oregon, while each of the 5 states has a different policy focus for their state strategy, Oregon's approach is squarely focused on the development of a 2-gen strategy to impact chronic absenteeism, which will augment the state's existing statewide efforts related to chronic absence and high school graduation. Oregon's state strategy includes using human-centered design to develop innovative pilots to disrupt intergenerational poverty while creating a 2-gen client-informed plan that will raise the school attendance rates by most of the disadvantaged children and youth, help parents achieve economic security, and support the parents' role as caregivers. So with this, I'm going to introduce our next speaker. I'll be handing the mic over to Robin Shobe, who is a chronic absenteeism specialist in the Oregon Department of Education. Robin has worked with education and community leaders across Oregon and has developed strategic partnerships to work towards changing chronic absence rates statewide. As a chronic absenteeism thought leader in a state that has such a strong emphasis on supporting family well-being and economic mobility, I'm very excited to have for you all to have the opportunity to learn from Robin about how Oregon is thinking about reducing chronic absence as one of the many components of increasing family well-being statewide. With that, Robin, you're up.
Thank you. I want to thank the National Governors Association for inviting Oregon to share its response to chronic absenteeism. Next slide. Let me see if I can change the slide. I did it. Just to give you a little bit of background of kind of where Oregon started, and then I'll end talking a little bit about the 2-generation strategies that we're currently basically learning about, studying, and trying to implement here in the state. But of course, one of our first steps, as you've heard from both Dr. Balfanz and Hedy Chang, is really understanding data and understanding the problem. So what you see here is, I guess for lack of a better way to call it, kind of a heat map of what Oregon looks like in terms of chronic absenteeism during the 15-16 school year. So the red being extreme levels of chronic absenteeism, the orange being high. In Oregon, we tend to see chronic absenteeism among both our urban, suburban, town, and rural school districts. But we also understand that what drives chronic absenteeism in an urban school district is probably very different than what drives chronic absenteeism in a rural or town district. So we are very fortunate to have strong support from our governor, Kate Brown, as well as support from our legislature. Our legislature passed House Bill 4002 in 2015, which directed us to really take a cross-sector approach, work with our partners to write a statewide chronic absenteeism plan. That plan was submitted to the legislature in 2016 and funded for the 17-19 biennium. Next slide, please, or maybe I can do it. I cannot. Next slide. What's extremely important to us, to our governor, to our deputy superintendent, Colt Gill, is that our plan is grounded in equity. We use the Oregon equity lens, as a tool for developing our plan. We want to ensure that all children across the state of Oregon reduce chronic absenteeism, but we also want to make sure that we're providing the right kinds of strategies and interventions to address our populations who see greater rates of chronic absenteeism in Oregon, those being our students of color, particularly our Native American, Alaskan students, our students who experience economic disadvantage, and our students with disabilities. So essentially what you see on this slide is the statewide chronic absenteeism plan in a nutshell. So the top left corner, the orange corner, the first thing that we're doing is the state is providing a statewide and local messaging campaign. We have 197 school districts. The majority of our school districts are rural or frontier, meaning that in many of these school districts, our cattle outnumber our people. And again, as Dr. Balfanz said earlier in the presentation, what drives chronic absenteeism in different areas, in different population densities are different. Transportation issues are different, access to health, etc. So we've been working also closely with Attendance Works and are so thankful for the support that they provided us as a state to be launching a campaign and hopefully having 197 of our school districts joining in September Attendance Awareness Month. The next thing we're doing is providing technical assistance and professional development. We will be putting best practice guidelines into the field. I think they will be modeled somewhat after Connecticut. They might be learning about that right now. Next slide, please. So the other two boxes, oops, the slides got mixed up a little bit as they got loaded, but the next two boxes show the other two components of the plan. And one of them is, if we're thinking about a multi-tiered system of support, is to provide targeted assistance to our districts that experience the highest rates of chronic absenteeism. It's important for us to also identify districts that will help us learn and will help districts learn from one another. So we stratified our school districts to make sure that we had both rural, or not both, but rural, suburban, town, what did I miss? Urban districts. So we will be supporting approximately 27 school districts to, as you can sort of see going across the arrows, but the words are down a little bit, to really identify their local strengths, the things that they're doing well, look at disaggregated data, look at their current efforts to promote good attendance, look for the places where we can improve, try to really understand the local drivers of chronic absenteeism, support them to develop a plan, and provide technical assistance, best practice guidelines, and in many cases, some grant funds in order to achieve good attendance. Next slide, please. In the last box, the last component of our program is we have set up a regional consortium. We have divided the state into 8 regions. We understand that, again, supporting districts from our capital, Salem, is difficult for us to then understand the local context, the culture, the climate. And so we wanted to make sure that this work was very local, that there was significant support for partners and cross-sector relationships and approach. We have divided the state into 8 regions. Those 8 regions are supported by a lead coordinator that then works closely with the Oregon Department of Education statewide chronic absenteeism team, so we can share both state partners and regional and local partners. We believe in Oregon that we have looked closely at the research that's been done by individuals such as Dr. Balfanz and the work that Attendance Works has done, but we still believe that many of the drivers of chronic absenteeism in Oregon are sort of unique to the communities, and sort of the solutions are still we're still figuring out what some of the effective solutions are. So a big piece of setting up this consortium is to really be able to share lessons learned, as well as the mistakes that might be made as we go forward, really trying to support this important issue. Next slide, please. This is one example of some data that we've provided schools. And basically what we did was map every single day of attendance in the K-5 to give districts more ways to think about their data and to be asking questions about their data. What this graph showed was our most attended day of school was the first day of school, and we actually never, this particular school district never had attendance as good as the first day of school. But its next best day of school was the day before Valentine's Day. So we're thinking that we just need to give lots of candy out. I'm completely kidding. That is not what it means. But very interesting, right? That this is a very obviously a celebration at school that kids worked very hard and families to get kids there on that day. This district in particularly also found that when it analyzed its data that it had very poor attendance on late start days. We've had another district say that they have late start Monday and they have excellent attendance on those days. So these are additional strategies that we believe our districts can use. Just making small adjustments to calendars might significantly change the attendance that kids are able to achieve. Next slide, please. And lastly, we are very fortunate in Oregon to have received a grant from the National Governors Association, from the CLAFS, the Center for Law and Social Policy, and also from PACT, Parents and Children Thriving Together. And we have been able to go out to 5 very different communities/districts and really look at using a human-centered design approach, talk to families, talk directly with children, talk with educators, talk with community leaders about what they think the barriers and opportunities are for good attendance in these different areas across the state. There are definitely some general themes that are rising up from the work that we've done. And of course, as we're going out to do this work, we're really raising an awareness among all of these different groups about the importance of attendance, its relationship to academic and social emotional success. I also believe that as we're talking to educators and we're talking to community, the 2-generation approach is resonating very strongly. We're becoming simultaneously trauma-informed practice is also something that we are taking very seriously in our state, and our educators are learning a lot about. And so the 2-generation strategy approach, along with a better understanding of how trauma might be impacting our students, is really helping, I think, students and educators in the community understand that we really can work together to remove many of the barriers that keep kids from. So with
Thanks,
that,
Robin, so much for that.
Yeah, I'll wait for questions. Thank you.
Thanks, Robin, so much for that great example. And last, we're going to turn to our Health Division to introduce our next speaker, Susan Dawson from the E3 Alliance.
Hi there, this is Akisa Coleman from the NGA Health Division. We're really excited to be participating in this conversation. A lot of our work has focused around social determinants of health and really seeing chronic absenteeism as kind of both a mix of both a social determinant and a direct health need. So really excited to turn things over to Susan Dawson at the E3 Alliance to talk about some of the great work that they've been doing in Texas.
Susan? Susan, we just want to make sure you unmute your line. If not, while we wait for Susan to get back on board, we can take some questions for our experts that are on the line. And I think that's what we'll take this time until we know that Susan's back online. So if you have a question, Tiffany had talked about some of those norms before, but just use the devices to let us know that you have a question.
Seth, can I, while you're looking for those, mention just something about a connection with what Robin was talking about with trauma, which is that, this is one of the reasons why you have to really, what Bob was talking about, that shift from truancy to positive problem solving is so critical. I think there's actually growing evidence that kids who have higher AC scores are more likely to be chronically absent. And it means that if a kid's been facing, or a family has experienced trauma, the last thing they need is a kind of a punitive approach. What they need is this really trauma-informed approach where you connect with a child, you find out what's going on, and then you really use that relationship to motivate better attendance and to find out what are those challenges they're facing so you can bring them back to school. And I think that's why taking a two-generation approach, as Robin was talking about, is so essential, because it's relationship building with both families and with kids. And kids who are highly vulnerable tend to experience chronic absence at even earlier ages, which makes having that connection to their family so you can get them on the right path at the start of school is so key.
Hedy, this is Susan Dawson. I think I've been unmuted now. There was a little problem with the muting, but I just want to reflect before I jump in that what you're saying is exactly what we see in the data, where families who've experienced early stress and trauma are the ones that we see with very low attendance in the pre-K and kindergarten years and really need to be addressed very quickly.
Great. So glad you're here, Susan.
Great to be here. So why don't we just launch into the slides?
Perfect.
If you can move them forward for me and keep going. We worked starting in 2011 in the Central Texas region to address attendance and later chronic absence because our superintendents asked us. This was a time when budgets were being cut across the country, certainly here in the state of Texas, and we worked with our 15 partner superintendents who really asked us to develop a regional approach to attendance because in the state of Texas, as in many parts of the country, we have this triple bottom line benefit of students can only learn when they're in class, teachers can teach when they're there, but because it is the way our schools are funded based on average daily attendance, it increases revenue to districts to improve attendance. And also, unlike, for instance, hiring or firing teachers, this is something that communities can directly and positively impact. And so starting in 2011, E3 Alliance began by spearheading a regional approach to increase attendance. Based on objective data, that's the foundation of all of the work that we do. And I won't show you because I don't have time today, but we looked at comparing our data across grades, similar to some of the data you saw earlier from Bob Balfanz, and comparing our communities to others around the state, and many, many initial data foundations to start the work. Next slide, please. Based on that data, we launched in 2012 a regional awareness campaign called Missing School Matters that was meant to focus and galvanize the community around the understanding of the importance of addressing attendance and working together to improve attendance. Go ahead. One of the targets of this work was not just the community. Can we get the next slide, please? There we go. But the business community. And so it was important to us that we make this case based on return of investment because every day a student misses school costs about $40 to schools, and that rolls up very quickly. In fact, the average high school was losing about $20,000 a week, and across our region, we were losing over $90,000 a year. So with that data in hand, we set an overarching goal for the Missing School Matters campaign to be able to reduce absences and bring money back to our districts. You can go through the next slides very quickly. I just wanted to show you a couple of examples of some of the work that we did. We had posters on the inside and outside of our buses, our public transportation systems. In the next slide, you can see we presented at South by Southwest and had booths and got interest in the community. The next slide, we've had flyers that we give out every year around different holiday events when we know that students are not going to be maybe taking off early or coming back late in English and Spanish. Next slide, we worked with school nurses to develop parent guides for students to help them understand what the rules of the game were, if you will, and how to manage attendance with their students. So that was a lot of work that we did early on. But then if you look at the next slide, we knew that we had to move much more deeper into understanding not just how do we raise awareness, but how do we understand what are the root causes for student absences. So in 2013, we undertook a regional absent reason study to understand exactly which students were missing school, why. It's a very expensive study because there is not a lot of good data that's kept consistently on absence reason codes. And we took that results and we overlaid it on health data. And if you click one more time, based on that, we really wanted to understand the interchange between health and attendance, and we found that the overarching, almost half of all absences, the overarching reason was acute illness. So we overlaid that on our flu data and determined that the peaks in absences exactly overlaid the peaks in flu instances. And so we started a flu immunization campaign, which now has won national awards. We were able to demonstrate that we saved $500,000 last year just in the 3 peak weeks of flu season for those schools that took part in the flu vaccination campaign. Go ahead to the next slide. After working at the absence reasons and the health issues associated with that, we really started shifting our attention to addressing chronic absence because it is such a strong predictor of student achievement, because there were significant gaps in different student populations. And in particular, we were launching into this in partnership with Dr. Balfanz and Hedy and her team and the White House around understanding how this impacted our young men of color around the My Brother's Keeper effort. And so we built a pilot using the school success mentors to pilot in schools here in Central Texas to understand how we could address those issues of chronic absence. And I'll show you just one data point in the next slide of the differences between different student populations. So in particular, if you look at ninth grade, which is a key area of chronic absence, our low-income Black and Hispanic males had about 30%, 27 to 32% chronic absence, far higher than our non-low-income males and females both. So one of the things that we did, take a look at the next slide, was go ahead and move forward, was looked at our bright spot schools. So what you see here, no, back up just one, is schools across the Central Texas region on the horizontal axis. We've paired schools that have common demographics. So based on the percent of low-income Black and Hispanic students that they have, from anywhere from very few on the left side to almost 100% of their students low-income Black and Hispanic. And then we looked at the chronic absence just of their My Brother's Keeper target population, and you can see that there are huge ranges from 80% or more down to 10% or less in schools that look exactly the same. So next slide. Based on this, one of the things that we've done, and this is not real data, obviously, is gone to particular school districts and showed them exactly where their campuses fall so that they can first understand how are my campuses doing compared to where I would expect to be based on my demographic population. And then second, how do I find best practices schools to compare to? Keep going. With the student success mentors that we undertook in conjunction with the White House at these schools that had the highest levels of chronic absence for their young men of color. Go ahead. We implemented the pilot model, and we were able to advance the students, use the student success mentors to advance attendance based on the prior year. So keep going. We had a variety of continuous improvement tools like process mapping, failure mode analysis, run charts, some like the example that you saw earlier. And by doing so, over half, in fact 57% of students who were previously chronic absent, we were able to take off of that in the first semester at our pilot schools. We're missing one slide, I think, that got dropped in the transition, but where are we going forward from here is really critical because we launched with Attendance Works last year an attendance summit that we'll be doing again with schools across our region. And we've also now formed a peer learning network where 10 schools will be working with us very intently over the next year to be able to focus on chronic absence and the reasons in their secondary schools and leverage what we learned from the school success mentors numbers in schools that we grow now across the region. So there's one more last slide, which I just want to show. So keep going, which shows that it's working. What you see on this graph is the total number of student absences in the blue bar across all the schools in our entire region. And then in the red diamonds is the total amount of the total number of absences. And what you can see, in fact, we have the data for the last 20 years, is that the absences exactly correlate to the growth of our overall student population across the region until 2012, when we launched this effort. And for the first time, those bars started diverging. That school enrollment continues to grow, but not as fast as the total number of absences. And in total, we've now saved $37.5 million to regional schools based on this work.
Thank you so much,
I'm going to turn it back over. I think we have just a little time for questions.
Exactly, just a couple minutes. But if you have a question, if our experts can just stay on for a few more minutes, we want to give our education policy advisors a chance to ask questions. And so I want to throw it. No question. And if there's not right now, please feel free to reach out to myself, Seth Gerson, sgerson@nga.org, or we have our education division email, education@nga.org. If you have questions for any of the experts today or any of us, including our health and human services divisions, we will get those questions to them and get it turned around pretty quickly. So we're really looking at this as the beginning of the conversation, and for it to continue. And so we'll keep moving forward. As I said, this will be archived. This webinar, we'll be sending that out as well, including some follow-up resources to continue the conversation.
I would just like to really quickly apologize to everyone for the sound malfunctions in the beginning, and then Susan Dawson, I know the issues that we were having. I would like to say a quick apology for that.
No problem. I'm glad we could all join.
Well, thank you to all our experts who joined today. And again, please feel free to reach out to us and we'll continue the conversation. Thanks. Have a great day.
Bye.